For many years, colorectal cancer treatment has focused primarily on surgery, chemotherapy, radiation, and surveillance imaging. These remain essential pillars of care and continue to save lives every day. But increasingly, the conversation surrounding colorectal cancer recovery is evolving beyond the operating room. Recent findings from the Challenge study, presented at a major oncology conference in Scottsdale, Arizona, have brought renewed attention to something many physicians have long suspected. Structured physical activity may play a meaningful role in reducing the risk of colon cancer recurrence after treatment. For patients recovering from colorectal cancer surgery, this represents an important shift in how we think about survivorship. As a colorectal surgeon, I believe this research reinforces a broader truth about modern cancer care. Recovery does not end when the incision heals. Long-term outcomes are influenced by a combination of surgical success, oncology management, lifestyle factors, and ongoing patient engagement. Understanding the Challenge study. The Challenge trial examined whether a structured exercise program could improve outcomes for patients who had already completed treatment for colon cancer. Specifically, researchers evaluated whether regular, guided physical activity could reduce recurrence rates and improve overall survival. The findings were significant enough to draw national attention within the oncology community. While exercise has long been associated with better cardiovascular health, weight management, and overall wellness, studies like this suggest that physical activity may also influence the biological environment in which cancer either returns or remains dormant. Researchers continue to study the exact mechanisms involved, but several possibilities have emerged, including reduced systemic inflammation, improved insulin regulation, enhanced immune system activity, better metabolic health, improved tolerance of ongoing treatments and recovery demands. Importantly, the study focused on structured exercise rather than vague recommendations to simply stay active. That distinction matters. It suggests that long-term survivorship planning may eventually become more intentional and multidisciplinary, incorporating exercise physiology alongside traditional medical follow-up. A shift toward lifestyle-integrated recovery. Colorectal surgery has advanced significantly in recent years through minimally invasive techniques, robotic-assisted procedures, ERAS protocols, and improved pain management. These developments help patients recover and return to daily life faster after surgery. The next step in survivorship care may focus more on long-term lifestyle support, including exercise and rehabilitation. While these do not replace surgery or chemotherapy, they may strengthen recovery beyond the hospital setting. Many survivors ask how they can personally reduce recurrence risk, and studies like Challenge now provide more evidence-based guidance for that discussion. What this means for patients in Arizona. Arizona is seeing major growth in advanced cancer care, especially in the Phoenix area. Medical centers are expanding research in precision medicine, survivorship, and long-term recovery strategies. More patients may soon benefit from collaborative care involving surgeons, oncologists, nutrition experts, physical therapists, and supervised exercise programs. Recovery after colorectal cancer treatment varies widely between patients, with some facing fatigue, weakness, or nutritional challenges after surgery and chemotherapy. Structured exercise and rehabilitation programs help patients safely rebuild strength, endurance, and quality of life. The focus is not peak athletic performance, but long-term sustainable recovery. Exercise and colorectal surgery. Recovery. One of the most important points for patients to understand is that exercise after colorectal cancer treatment should be individualized. Immediately after surgery, the body requires time to heal. Activity recommendations vary depending on the extent of surgery, whether a minimally invasive or open approach was used, the patient's overall health, the presence of ostomies or postoperative complications, ongoing chemotherapy, or additional treatments. However, once patients safely progress through the initial recovery phase, gradual physical activity often becomes an important part of rebuilding strength and quality of life. Even modest improvements in mobility and conditioning can have meaningful effects on recovery. Looking beyond the operating room. As surgeons, we naturally focus on technical precision, safety, and achieving the best operative outcomes possible. But colorectal cancer care does not end in the operating room. The Challenge study serves as an important reminder that survivorship is a long-term process. The future of cancer care will likely continue moving toward integrated recovery models that combine excellent surgical treatment with evidence-based strategies that support patients physically, emotionally, and metabolically after treatment. For patients recovering from colon cancer, that is encouraging news. Modern cancer care is no longer solely about removing disease. Increasingly, it is about helping patients move forward with strength, function, and long-term health after treatment is complete.